Hi, hello everyone. Good evening. Good evening, all. Am I audible and visible? Welcome to one short series. Today's topic is asphyxial death. In asphyxial death, one very commonly asked question is hanging. Yes, am I audible and visible? Just type hi. Hi, Brownie. In asphyxial death, there are four important topics. एक है hanging. The second, strangulation. Third, suffocation. And also drowning. Okay. The first one is hanging. The second one, strangulation. Third one, suffocation and drowning. In today's session, we are going to discuss about hanging. Yes, Rakesh, Editi. Shall we start? Yeah. What is hanging? Hanging means it's a form of asphyxia. Asphyxia matlab hypoxia and hypercapnia. Hypoxia means decrease oxygen concentration. Hypercapnia, increase carbon dioxide concentration. Caused by suspension of body. In case of hanging, there is a suspension. In strangulation, suspension is absent. You can see here once again, Brownie here. When body is suspended, that is hanging. In strangulation, body is not suspended. So this is one very important funda. That's why in case of hanging, there is an oblique ligature mark, which is a type of pressure abrasion. The cause of death usually asphyxia or sometimes venous congestion. One of the very common method of suicide in India. Why? Because it's easily available, like fan, ligature, available in every house. And second thing, it is one of the surest method of death. So death occurs within 1 to 2 minutes. As per recent data, the national data, the commonest method of suicide in India, that is hanging. The commonest cause is depression. So try to understand one very important MCQ. So there is a suspension of body. The suspension absent in strangulation. So it present only in the hanging, absent in strangulation. By a ligature, encircling neck, oblique ligature mark in case of hanging, transverse ligature mark in case of ligature strangulation. MCQ, dairy milk question, very commonly asked. Okay, yes. The constricting force being weight of the body in complete hanging. Weight of the head in partial hanging. So what is complete hanging and partial hanging? The complete hanging means entire body suspended like this, complete hanging. In partial hanging, the part of the body touches the ground. So it can be standing position, or it can be sitting position, kneeling position, prone position, or supine position. The cause of death is basically venous congestion. The face will be congested. Okay? Yes. So this is very important definition. I hope you understood. Say yes or no. Rakesh, Anish Agrawal, is it clear? Definition. Then what are the classical signs of asphyxia? Mnemonic hai A is equal to CPC. All of you write in the chat box, A is equal to CPC. Keep writing. So interact with me. So you can keep me awake. You can keep yourself awake. Yes, guys, come on. Yes, Rakesh, right? A is equal to CPC. C matlab congestion. P means petechial hemorrhages. C matlab cyanosis. Cyanosis means bluish discoloration. So most of the organs are congested, like brain congested, liver congested. Petechial hemorrhages, they are known as Tardu spots. Because of increased venous pressure, there can be bleeding from the venules, especially in the eyelids, over the conjunctiva, over the sclera, over the heart. Cyanosis, that is bluish discoloration. Okay, good. You can make out here 3 changes here. Classical findings hai. You can see here, this is congested brain. This is petechial hemorrhages. Non-specific finding, Tardu spots, pinpoint hemorrhages. And this is classical cyanosis. Then autopsy finding. What are the autopsy findings in case of hanging? Can anyone tell me what is the surest sign of antemortem hanging? Surest sign. Like example here, brown is here. What is the surest sign of antemortem hanging? That means the person was alive at the time of incident. Can anyone tell me? Look at this. Body suspended. Body is not touching the ground. Here is the knot. Knot is there. And there is protruded eye, protruded tongue. Neck is elongated. Oblique ligature mark. My question है, antemortem hanging में क्या finding मिलेगी? जल्दी बताओ. If you answer, you'll get 3D chocolate from me immediately. बताओ बताओ जल्दी. Come on guys, come on. Marking of the finger, nahi beta. Marking of finger is not seen in hanging. That is seen in case of strangulation. Question है hanging में. हाँ, very good. Cricket. Dribbling of saliva. Excellent answer. Excellent. Dribbling of saliva is a feature of antemortem hanging. Cadaveric spasm is a feature of antemortem drowning. Soot particle is a feature of antemortem burn injury. 3 important MCQ. चलो, first question है, first finding है ligature mark. Very important finding. When we visit crime scene as a forensic expert, first we will see ligature mark. क्या है? ट्रांसवर्स है, ऑब्लिक है. ऑब्लिक इन हैंगिंग, ऑब्लिक इन हैंगिंग. याद रखना. But sometime in partial hanging, it can be transverse also. But in general, it is oblique. And it is incomplete. Above the level of thyroid cartilage. It's a type of pressure abrasion. याद रखना पड़ेगा. This is very, very important. Then eyes. When you see eyes, eyes are protruded because of increased pressure over the neck. So more pressure, there is a more protrusion of the eye. And one very important finding, lay face is sympathetic. One eye is open, other eye is closed because of compression of cervical sympathetic chain. Because of compression of cervical sympathetic chain on the same side of knot. Same side. And in the eye, there can be Tardu spots. Tardu spots. Yes. Okay. This is about the eye. Then angle of mouth. At the angle of mouth, dribbling of saliva. It is the surest sign of antemortem hanging. It is because of stimulation of salivary glands. Important. Then eyelids. I said conjunctival hemorrhages are Tardu spots. The heart conjunctiva, there can be petechiae. Heart congested, brain congested, most of the organs are congested. Hyoid bone, so there can be fracture, that is outward fracture. Yaad rakhna, outward fracture in hanging, inward fracture in case of throttling or manual strangulation, very commonly asked. Then when there is a hematoma, then it is antemortem. And hyoid bone fracture common only after the age of 40, not before 40. Carotid arteries, there can be transverse tear, that is known as Amussat sign. Cervical vertebra, there can be fracture at the C2, C3, C4 in judicial hanging, which is known as Hangman fracture. Thoracolumbar vertebra, there can be hemorrhages. They are known as Simon hemorrhages. Again, non-specific. Simon sign. And when body is suspended, so example here, Brownie, when body is suspended for a long time, so usually what happens in case of hanging? So there will be suspension for about 5 to 6 hours. Usually the suicide and all takes place in early morning or in the night time or for some time. So there will be collection of blood in the dependent area, in the lower part of the lower limb, lower part of the upper limb. That is known as glow and stalking hypostasis. And this glow and stalking hypostasis get fixed after 6 hours. After 6 to 12 hours. Sometimes there can be, a seminal stain also. Then CPC present, as I said before. Neck dissection. Neck should be dissected at last, not in the beginning. And ligature material should be cut opposite to knot. Skin incision, remember Y-shaped incision. So all these are very commonly asked. Now some more important one-liners. Cause of death. Can anyone tell me what is the cause of death? Cause of death batao. There are many cause of death. Can you tell me one or two cause of death? Come on guys, come on. Keep answering. I'm just waiting for your answer. Alka Kumari, cricket, Rakesh. बताओ क्या आंसर है? The most common cause of death asphyxia है. Sometimes it can be venous congestion. So, which is most common. Sometimes it can be cerebral anemia. Because of occlusion of carotid arteries. Vasovagal inhibition. Sometimes it can be fracture of cervical vertebra, especially in case of judicial hanging. ठीक है? Then comes his manner. The manner है manner. So the manner most commonly suicidal. Sometimes it can be homicidal, which is known as lynching. It can be judicial or accidental. Accidental. That is associated with autoerotic hanging, commonly associated with transvestism and petechiism. So there will be partial hanging, there will be partially naked or no cloth on the body. Sometime I have seen 1 or 2 cases where one male around 20-year-old found dead in his residence. The house was closed from the inside. No foul entry, no suspicion. During crime scene visit, what I found the male wearing female dress, like female sari, petticoat, and also I found features of transvestism, petechism. And in the crime scene, there was a mirror exactly in front of the dead body and a computer screen showing some dirty material. So when you see these kind of picture, solitary activity, transvestism, petechism, that is classical of autoerotic hanging, known as sexual hanging. The sexual hanging is accidental. It is also known as Coates-Varism. Okay? Yes. So this is about the definition, briefly about the autopsy finding, the cause of death and manner of death. I said neck dissected at last. The incision is Y-shaped incision. Now it's your turn. You need to answer. Now look at this. This image, there are 10 images. Okay? In this image, there is a case of hanging. The knot is there at the nape of the neck. What is this known as? Knot है at the occipital region here. इसको हम क्या बोलते हैं? Yes, come on guys, Manak Datta. What is this? So this is basically known as typical hanging, where knot is present at the nape of the neck. If knot is there here, there, anywhere, that is atypical. Atypical anywhere. एक और finding है. In judicial, normally it is submental, but the most common position of knot is either right angle of mandible, left angle of mandible. So I think Rakesh, this is Rakesh beta, this is typical hanging है. ये atypical नहीं है, atypical hanging है. Nobody is answered. चल. Next question. What type of hanging is this? You can see here there is a stool and a dead body is suspended completely. The weight of the body acts as a constricting force. इसको हम क्या बोलते हैं? The cause of death is asphyxia because of occlusion of carotid arteries and jugular veins, vertebral arteries. At 30 kg weight, most of the veins, most of the arteries and trachea will be obstructed. That leads to sudden death in 1 or 2 minutes. What type of hanging is this? Yes, cricket, Manak Datta. So this is complete hanging. Cause of death है asphyxia. In complete hanging, face is pale. This is ligature mark, oblique ligature mark, and here no body part is touching ground. So nobody has answered. Okay. Then this question, look at this and try to answer. Now I am in Shava Pariksha room. Guys, concentrate. So now I am entering Shava Pariksha room. During examination of the face, I can see something here. Something from the angle of mouth. Now my question, is it suicidal or homicidal, antemortem or postmortem? क्या finding है? ये देखो, finding है. Now you are forensic expert. You are detective now. This finding, what is this? Come on guys, answer. Ha, very good. Cricket. This is dribbling of saliva. That is a feature of antemortem hanging. That is a feature of suicidal hanging. Excellent. So, cricket is telling. So, cricket, good answer. Dribbling of saliva. बेटा ड्रिबलिंग है, एंटीमॉर्टम है. एंटीमॉर्टम मतलब यूजुअली सुसाइडल है, अनलेस अदरवाइज प्रूव्ड. ठीक है, गुड. नाउ लुक एट दिस. नाउ यू आर इन शव परीक्षा रूम. One eye is closed, one eye is open. The pupil is more dilated. On the same side of knot, you can see here. ये क्या है? Now you try. Manak Datta, Rakesh, cricket. What is this? This is known as Lephasis sympathetic. It's a feature of antemortem hanging, seen in 30 to 40% of the cases because of compression of cervical sympathetic chain. You can make out here dribbling. You can see here protruded tongue also. Okay. Yes, very good, Manak. Manak, very good. Now one more image in case of hanging. Now look at this finding. There are pinpoint hemorrhages over the eyelid, over the heart, over the lung. As we say, pult-off hemorrhages in drowning. And these are basically known as Tardu spots. ये क्या है? Tardu spots है. Tardu spots around 0.2 to 1 millimeter size. याद रखना, नॉन स्पेसिफिक है. Non specific. Good. Then the sixth one. What is the finding here in sixth one? Now I am in Shava Pariksha now. Booth bungalow. By this is hyoid bone. The body of hyoid bone. The greater cornu, lesser cornu. There is a finding here. What I can see here, hematoma. Clearly visible hematoma is there. And the age of the patient is more than 40. What is this then? ये क्या हो सकता है? बताओ बताओ जल्दी बताओ. This is basically compression fracture, also known as outward fracture of hyoid bone, commonly seen after 40 years. When hematoma is there, it is antemortem. Hyoid bone fracture can be seen in throttling also, that is inward fracture. It can be seen in road traffic accident also. Okay, good. Carnohematoma, Divyak, very good. Good answer. Chalo ho gaya sixth one. Seventh one, before that, look at this. Now you are in Shava Pariksha room, look at this. This is how we examine hyoid bone. This is hyoid bone in a 20-year-old male found dead due to hanging. What you can see here, the hyoid bone is intact on both the side. It's intact. Okay? Yes. Okay. Now the finding is the carotid artery. Revision hai. When you see transverse tear like this in the intima of the blood vessel, you can see a transverse tear. इसको बोलते हैं Amussat sign. This Amussat sign is seen very commonly in judicial hanging. ये क्या है? Transverse tear in carotid artery. And this is histopathology. This is intima of the blood vessel. A intima hai. Okay. So try to understand. This is very commonly asked. And the eighth question. You try by yourself. I'll give you 20-second time. Identify and answer in the chat box. I'm giving you clue. This is the case of judicial hanging. In judicial hanging, they place ligature around the neck. not at the level of chin. There will be sudden drop at a height of 10 to 20 meters. At that height, there will be separation of spinal cord from the medulla oblongata, causes respiratory paralysis and death. As you know, respiration controlled by medulla and pons. Once it is damaged, there will be sudden death. What is this, Rakesh? Yes, so this is basically C2, C3 fracture, C2 fracture, Hangman fracture. The most common site is, that is basically C2. And the ninth question, look at this in case of hanging. So there is a finding. What is this finding? And there is no color change and it is permanent. What is your inference in case of hanging? A male found dead in a state of hanging. The dead body was recovered by the police under the section 194. The dead body is sent to postmortem department for autopsy. During autopsy, there is a postmortem staining and there is no color change on compression. My question है, what is time since death? And what is this known as? Very good. So this is basically postmortem hypostasis. And it is fixed. Matlab more than 6 hours. And what we can see here, vibices also. Vibices are very clearly visible, the blue colored patches over the body. In case of violent asphyxia, 6 to 12 hours. Good, cricket. And the last question, not related to hanging. It is related to some condition. What we can see here, petechial hemorrhages over the eyelid, over the body, and there is a red area, clear line of demarcation. What is this? It is related to some cricket celebration happened in Bangalore. Can you identify what is this? There is a deep cyanosis. There are petechial hemorrhages. Clear line of demarcation. What is this known as? What is this? Smothering? No, it is not smothering beta. It is not poisoning. नहीं है, smothering में नहीं है. Smothering you will not see picture like this. You can see clear line of demarcation. Look at the face, deep cyanosis. Try. No, it is not Hangman fracture. Hemorrhage, वो भी नहीं है. It is not due to hanging. It is due to something else. It is due to asphyxia, a type of asphyxia. What is this? Try. Seat belt, no. Beta seat belt नहीं है. Cricket, not seat belt. It is some celebration. Some celebration was going in a hall. Suddenly there was an earthquake. Suddenly there was stampede. And death of many people in that. Seat belt नहीं है. Try guys. It is due to stampede. I am giving you clue. Stampede. No, beta, man, not postmortem hypostasis. No. It is known as mosque ecchymotic. I am giving you clue. Mosque ecchymotic. Very good, cricket. He got the answer. Traumatic asphyxia. ये क्या है? Traumatic asphyxia. Good. Answer given by Manjunath. Great. So this completes today's small topic. And if you have any doubt, you can ask me. So I'll just summarize. In hanging, there are internal finding and external finding. So in general findings are ligature mark है. इसके बाद lay faces sympathetic है. Dribbling of saliva at angle of the mouth. Petechiae at the eyelids, heart and conjunctiva, outward fracture of the hyoid bone, carotid artery shows Amussat sign, cervical vertebra there is a Hangman fracture, thoracic vertebra shows Simmons sign, glow and stalking hypostasis, and cause of death is asphyxia or venous congestion. Neck dissection done at last, skin incision is Y-shaped incision. Cause of death can be दम घुटना, asphyxia, venous congestion or cerebral anemia हो सकता है, or vasovagal inhibition in some cases, and cervical vertebra fracture in judicial hanging. Manner है suicidal, most common manner है, homicidal known as lynching है, judicial cause of death है hangman fracture, accidental in autoerotic hanging. Okay, any doubt in this? Any doubt? Come on, try. Say yes or no. Everything clear? Then I have two more questions. Wait. Two more chocolate questions at the end. Okay. Everything clear? Say yes or no. Now I have two questions at the end. Very interesting question. Yes, look at this. This is not related to today's topic. Look at this video and try to identify. This is a case of brain dead due to road traffic accident. His brain is dead, but on stimulus, usually neck flexion, what we can see here, sudden movement of the limbs like this. Sudden movements like this. In brain dead, what is this sign known as? This is known as Lazarus sign. All of you right? Lazarus sign. It is seen in case of brain dead. So brain is dead, but nerves are functioning. Some spinal nerves. On neck flexion, so the body do respond. There will be sudden movement, the flexion of limbs like this. You can make out here. So Zarco phenomena, as you said. You can see here one more time. Stimulus, brain dead hai. देखो neck flexion, the movement of the limb. Classically known as Lazarus sign. Good, Rakesh. Great it is. Now, I will do an acting. You need to find out what is the cause of death. Yes, guys. Maneuver hai. Okay. So imagine this is alcohol, and this is some non-veg or some hard material. You just find out what is this death of asphyxia. Okay. जो डर गया समझो मर गया. Yes. Yes, guys. What is this known as? Sudden death while having alcohol along with some food material like banana or some non-veg, leading to vasovagal inhibition and death. What is that known as? Try. Manak Datta is telling, sir, cafe coronary syndrome. Excellent answer. Rakesh is also telling, sir, cafe coronary syndrome. Great. So great, Rakesh. Manak Datta. Good. Chalo, now some more maneuver you need to identify. Now Brownie here. What is this known as? Yes. Try all of you. What is this type of asphyxial death known as? I am using fingers over the neck. What is this? Try. Death occurs in 1 or 2 minutes because of vasovagal inhibition or because of asphyxia, because of venous congestion. What is this asphyxial method known as? Try. Come on, guys, come on. So we discussed about Caffey-Condry syndrome. Now the next question is, so this is basically manual strangulation, like this manual strangulation. Nobody has answered, that's okay. Now one more method. Now again, brownie is here. The closure of mouth and nostril, like this. What is this known as? The closure of external air passages, like mouth and nostril, a type of suffocation. What is this known as? Try. This is known as smothering. So this is smothering. This is basically manual strangulation. Okay. Good. Yes. So this completes your today's session. Let's come up with some more interesting topics in upcoming classes. If you have any doubt, you can ask me. I'll be there for next 2 or 3 minutes. Any doubt? Anything? You can ask me for next 5 minutes. So I'll be here. Acha, strangulation. So strangulation we will do in next class. So there are different types of strangulation. Ligature strangulation, manual strangulation. One very commonly asked is ligature strangulation. With help of ligature, you will see transverse ligature mark, 6 penny bruises in throttling. Okay. Burking is a method of suffocation. Mugging is a type of strangulation. Bansdola is also a type of strangulation. Alka Kumari. Okay. So strangulation, there can be many types. So one is ligature strangulation, LS, manual strangulation, MS, Bansdola, then mugging, garroting, and Spanish windlass. So there are basically 6 types are there in strangulation. Then in suffocation, so try to memorize this. Suffocation. The one very commonly asked is smothering. That is occlusion of external air passages. Choking. That is the cloth in the mouth that occludes the pharynx and the air entry. Caffey-Coronary syndrome. Traumatic asphyxia. Abnormal positional asphyxia. Then burking. So burking is very commonly asked in exam. Then one more important topic you must know is drowning. So we will discuss drownings in some other class. Types of drowning, postmortem findings, and medico-legal importance. Very commonly asked. So time being, we will stop here today. We'll come up with some more lectures, some more important case scenarios, and some more images in upcoming classes. Thank you all.